Polycystic Ovary Syndrome, PCOS, is a bit of a hormonal rollercoaster for women. What happens is that girls with PCOS end up with higher levels of male hormones than usual. Now, this hormonal change can mess with the regular menstrual cycle and throw a curveball for those trying to get pregnant. Curious about why PCOS happens, or wondering what it does to a woman's body? Well, stick around and we will spill the beans on the possible causes and effects of this hormonal shindig. Let's begin. PCOS is like a hormonal hiccup that pops up in women between 15 and 44. 2.2 to 26.7% of girls in this age group might be dealing with PCOS, but many don't even realize it. A shocking 70% in one study had no clue they were in the PCOS club. Your ovaries are the hormone HQ. They're in charge of estrogen, progesterone, and a sprinkle of male hormones called androgens. These hormones are like the conductors of the menstrual orchestra. Normally, your ovaries release eggs every month for a potential baby rendezvous. This egg release is called ovulation, and it's orchestrated by hormones called FSH and LH. Enter PCOS, our troublemaker. It's a bunch of symptoms messing with your ovaries and the ovulation party. The trio of main features includes cysts in the ovaries, extra male hormones causing some imbalance, and a floor where periods go a bit offbeat, either irregular or taking a rain check. Cysts are little egg nests that never quite hatch, so the hormonal harmony goes out of whack. Progesterone levels take a dip and androgen levels decide to throw a party. This hormonal chaos messes with the menstrual rhythm, resulting in fewer periods for the PCOS crew. And get this, PCOS is not a new kid on the block. Back in 1721, an Italian physician named Antonio Vallisneri was the first to notice its symptoms. Causes of PCOS. Let's discuss the mysterious world of PCOS and what might be causing this hormonal puzzler. Doctors are a bit like detectives here. They're still figuring out the exact culprit, but here are some leads. First up, the theory is that too much of those male hormones mess with the ovaries' hormone production and egg-making skills. It's like the hormones are playing hide-and-seek when they should be doing their job. When we talk about genes, studies suggest that PCOS has a family connection, like a genetic family reunion. It's not just one gene causing trouble, it's like a bunch of them decided to team up for this hormonal disruption. Next is insulin resistance. Imagine insulin as the VIP ticket to the sugar-to-energy conversion party. But in PCOS, some cells don't get the memo on how to use insulin properly. This confusion makes the body demand more insulin, and the pancreas works overtime, making extra insulin. And this extra insulin gives the ovaries the nudge to produce more of those male hormones. It's like a blood sugar drama with unexpected hormonal guests. Now, let's talk about the heavyweight champion, obesity. It's not just about squeezing into those skinny jeans. It's linked to insulin resistance, making it a prime suspect in the PCOS case. Both obesity and insulin resistance also team up to increase the risk of another troublemaker called type 2 diabetes. It's like a trio of troubles. Lastly, inflammation joins the PCOS party. Women with PCOS often have higher levels of inflammation. And guess what adds fuel to the fire? Being a bit overweight. Studies even show that this inflammation boost is linked to having more of those pesky male hormones. It's like a domino effect. Hormones out of balance, inflammation joins the scene, and suddenly it's a hormonal carnival. Common symptoms of PCOS. Some women notice these things right around the time they start getting their monthly visitors. Others stumble upon these hints after gaining a few extra pounds or hitting a roadblock on the baby-making journey. Now, imagine your menstrual cycle doing a bit of a twist. With PCOS, it might decide to be a bit irregular, like forgetting to clean up the mess every month. Some ladies might end up with fewer than the standard 8 periods a year, or none at all. The uterine lining hangs around for an extended stay, making your periods a bit heavier than the usual light affair. And when we talk about a surprise hair situation, more than 70% of PCOS people experience a bit of unexpected hair growth. Not on their heads, but on their face, belly, back, and chest. It's like your body decided to play a hair growing game you never signed up for. The fancy term for this is hirsutism. Due to those male hormones, your skin might decide to get a bit oily. cue the acne brigade setting up camp on your face, chest, and upper back. PCOS and weight sometimes go hand in hand. Up to 80% of girls with PCOS might find themselves carrying some extra baggage. It's like your body's holding onto weight like a souvenir. The hair on your head might decide to play a hide-and-seek, thinning and possible hair loss in a male pattern way. It's like your scalp is having a bit of a follicular rebellion. Dark patches of skin show up in body creases, like the neck, under the breasts, and in the groin. And just to keep things interesting, hormone shifts might throw in a surprise headache. PCOS might come with a bunch of quirky symptoms. If any of this sound like familiar faces, it might be worth having a chat with your healthcare pro to figure out the game plan. Diet and lifestyle tips to treat PCOS. So, first up, we should focus on lifestyle changes. And it's not about crazy, impossible stuff, just simple tweaks like shedding 5 to 10% of your body weight. This weight loss isn't just about fitting into skinny jeans. It's like a magic trick that can make your menstrual cycle behave and tone down those PCOS symptoms. Bonus points, it's like giving your body a makeover inside, improving cholesterol and insulin, and showing heart disease and diabetes the exit. Coming up to the diets, any plan that helps you shed those extra pounds is a win. But some diets have superhero powers. Studies claim that low-carb diets are like PCOS kryptonite, effective for weight loss and waving goodbye to high insulin. Ever heard of a low glycemic index diet? It's like getting your carbs from the good stuff, fruits, veggies, and whole grains. This diet does a better job at keeping your menstrual cycle in check compared to regular weight loss diets. Having 30 minutes of moderate intensity exercise just 3 days a week is beneficial. Exercise also teams up with weight loss to improve ovulation and insulin levels. Combine a healthy diet with exercise and it's like a dynamic duo fighting PCOS villains. Together they help you lose even more weight and kick diabetes and heart disease to the curb. Ever thought about acupuncture? There's a bit of mystery around it. Some say it might be like a secret weapon against PCOS, but yet there is no proper research evidence proving that. Medical treatment. First up, we've got birth control pills. These come in different forms like pills, patches, or even a vaginal ring. Taking progestin, one of the hormones in these pills, is like sending a message to your body to get back in sync. It helps balance these hormones, keeps ovulation on track, and even tackles PCOS sidekicks like excess hair growth and acne. Next, we have metformin, a bit of a multitasker. Originally a diabetes superhero, it also joins the PCOS team by giving insulin levels a boost. It's like a power-up for your body. A study claimed that taking metformin alongside a diet and exercise plan does wonders. Better weight loss, lower blood sugar, and a menstrual cycle that's back to its irregular rhythm. Clomiphene, the fertility wizard. If you're dreaming of a tiny human, this drug might be your sidekick. Just a heads up though, it could up your chances of having twins or even more little ones. Family planning at its unexpected finest. For the battle against unwanted hair, we've got a few tricks up our sleeve. Eflornithine cream is like a secret agent slowing down hair growth, while laser hair removal and electrolysis can zap away that pesky hair on your face and body. And if all else fails, enter surgery, the last resort. Ovarian drilling is like a mini mission to restore normal ovulation. It's about making tiny holes with a laser or a heated needle to get things back on track. If you found this info helpful and want more updates on health and wellness, don't forget to give this video a thumbs up. For even more fantastic content, make sure to hit the subscribe button and ring the bell icon. Stay tuned for more helpful tips and take charge of your health journey. Thanks for watching.